Ladies and gentlemen, esteemed colleagues, and honored guests, I stand before you today to address a critical issue that demands our attention and concerted efforts: the pervasive racial disparities in healthcare. Today, we will dive into the importance of considering racial injustices within societal institutions when analyzing these disparities. It sheds light on unconscious biases, unfavorable stereotypes, and institutional policies that form the biases for systemic discrimination in healthcare. To effectively address these disparities, it is key to call for new initiatives, including recruiting more providers from underrepresented minority backgrounds, enhancing the training of medical professionals, and implementing rigorous regulatory vigilance and data systems. It emphasizes that ending racial disparities in health and medical care should be a national priority. We also need to move beyond the limited viewpoint that associates racism solely with the conduct of individual offenders. Instead, I urge you to recognize and confront structural racism in healthcare, a complex web of interpersonal interactions, social structures, and beliefs that favor the white population while disadvantaging racial and ethnic minority groups. Central to this discussion is the recognition that laws and policies play a pivotal role in perpetrating structural racism in healthcare. It is also relevant to highlight health insurance disparities as a glaring example, demonstrating how inadequate coverage contributes to unequal access to high quality health care. It can be urged that federal government acknowledgement of these issues is crucial in understanding and addressing health disparities. However, today's highlight of our discussion centers around a beacon of hope: the Equitable Health Care for All Act. The legislative reform aims to ensure equal access to health care as a protected civil right, responding to the ongoing racial disparities and systemic shortcomings within the American medical system. Let us dive into the critical provisions of the Equitable Health Care for All Act. First, the Act seeks to provide a clear and comprehensive definition of inequitable health care to address the unequal distribution of healthcare services based on factors such as race, national origin, sexual orientation, gender identity, disability, age, or religion. This definition is crucial to ensure that hospitals equally provide high quality health care services to all patients. Second, the legislation proposes the creation of a federal health equity commission task with overseeing and evaluating the progress of healthcare equity efforts. This commission is essential for monitoring the implementation and impact of the proposed measures. Third, the Equitable Health Care for All Act recommends the establishment of a dedicated office within the Department of Health and Human Services, responsible for recognizing health care as a protected civil right. This office will be crucial in promoting equitable healthcare practices throughout the system. Fourth, the Act suggests improving data collection methods to guide more equitable healthcare practices. This involves gathering extensive data on healthcare outcomes for various demographic groups to understand current discrepancies better. Fifth and finally, the proposed bill recommends providing financial grants to healthcare providers to encourage the adoption and offering of equal healthcare. These grants aim to support projects and initiatives actively reducing disparities in health outcomes and promoting fair access to high quality medical care. Support for the Equitable Healthcare for All Act is widespread, with endorsements from prominent groups such as the American Diabetes Association, National Urban League, National Disability Rights Network, and the NAACP. These endorsements signify a collective commitment to dismantling systemic inequalities in healthcare and creating an environment where healthcare is a fundamental right for all. In conclusion, the Equitable Healthcare for All Act is a comprehensive legislative proposal tackling health disparities root causes. It takes a holistic approach, recognizing the interactive social determinants that underlie these disparities and aiming to break down the obstacles preventing marginalized and vulnerable groups from receiving high quality health care. As we consider this legislation, let us acknowledge the significance of the proposed Federal Health Equity Commission. This independent organization will play a vital role in holding healthcare facilities accountable and promoting laws that align with the goals of the Equitable Healthcare for All Act. The vision presented by Representative Schiff, the sponsor of the act, is one where every American has access to top quality medical care. The Equitable Healthcare for All Act represents a tangible step towards achieving this vision. As responsible stewards of healthcare, let us lend our support to this critical legislation and work towards a future where health equity is not just an aspiration, but a reality for all. Thank you.